New today, Newark-Wayne Community Hospital announced it's closing its labor and delivery unit this year. Plans are already underway with the official closing set for late summer, early fall. News 10 NBC's Erin Mahin spoke with hospital officials. She joins us live from Newark. So Erin, tell us what's behind this decision.
Yeah, Deanna, so the hospital says it's seeing a change in its demographics throughout this region, and those changes are following national trends. So women are having children later in life, if they're having them at all. The hospital says its needs in this community revolve around its aging population. So going forward, it's focusing its resources there. Not to mention, this is a low-risk birthing center. Doctors say women who give birth later in life face higher risks, so they're already being transferred to other hospitals from here. In addition, the hospital says it's struggled recruiting OBGYN physicians to this rural area.
We're recognizing that we have a lot of work to do to prepare for the future, right? We're not just looking at today and tomorrow, but we're thinking 5 years out. What is this community going to need? And we need to increase our outpatient offerings. We need to increase access in our outpatient settings so that we can appropriately address that level of care.
The hospital will still offer outpatient services for mothers before and after birth. And this is the only birthing center in Wayne County. So doctors noted they'll be working with patients individually to make sure they have a new place. That also goes for the 37 employees who work at the birthing center here and who will no longer have a job once the unit shuts down. Reporting live from Newark, Erin Mahin, News 10 NBC.
Thank you so much, Erin. So what we're hearing now is the hospital says there are a few more steps that it has to take before officially submitting its closure proposal to the Department of Health. Once that is submitted, the department will make the final decision on the unit's official closing date. Now, this closure is part of a national trend, so let's go in depth on that. According to the advocacy group Saving Rural Hospitals, since 2020, 133 rural hospitals have stopped delivering babies or announced they will stop by the end of the year. That's a 12% reduction. Only 41% of rural hospitals in the U.S. still offer labor and delivery services. Fewer than half of rural hospitals in New York offer them. Now, in rural areas, women often have to travel at least 30 minutes to deliver their baby. In fact, it's often 50 minutes or more of that drive.